Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Our topic today in Neighborhood Health Watch is robotic thoracic surgery, particularly lobectomy for lung cancer. Lung cancer is the second most common cancer in both men and women. It's also the leading cause of death, cancer death among both men and women. More people die of lung cancer than of colon, breast, and prostate cancers combined. Most lung cancers could be prevented if people just didn't smoke. Dr. Graham Bundy with the Sarah Cannon Cancer Institute at Henrico Doctors Hospital is here to get us informed. And thanks a lot and welcome to First at 4.
Thank you. Good afternoon.
There are many different surgical treatments for treatment options rather for cancer. Talk about some of those as it compares to this robotic surgery assisted treatments.
Lung cancer traditionally has been treated with a thoracic surgical procedure called a thoracotomy. And the way that is performed traditionally has been through a very large incision, sometimes 10 or 12 inches long, in the side of the chest. In order to do that procedure, we have to spread the ribs, so it can be very painful. These new techniques that we have now, particularly using the Da Vinci robot, allows us to make several small incisions and then very carefully divide the artery and the vein that go to the portion of the lung we're going to remove and divide the bronchus, and that allows us to safely remove the specimen without having to spread the ribs, and it aids in a very quick recovery. A lot of patients sometimes leave the hospital after just 2 or 3 days.
And how does this technique help you as a surgeon?
It's actually a very precise technique. The visualization is fantastic. We have a magnification using the robot of over 10 times, so structures can be seen very well, and then the tips of the instruments are manipulated very much like a surgeon's wrist, but they're on a much smaller scale, so we're able to get around very fine structures without having to use large equipment, and it allows patients again to more quickly recover.
Does this change the narrative any when it comes to cancer screenings?
I think it does. One of the new things that we're doing and centers throughout the country is preventive screening for lung cancer. So CT scans can be performed, a low-dose CT scan that allows us to detect pulmonary nodules that can be cancerous at a much earlier stage of cancer. And when patients can be detected when they're stage 1 or stage 2, we often are able to treat them surgically.
Okay.
And the results are better. So they have a better chance at having a 5-year survival and beating their cancer.
And we want to let people know that there's a big event coming up on Election Day next Tuesday at Henrico Doctors Hospital, and this has to do, can you tell us a little bit about this? I believe it has to do with screenings and people sharing the journey, their own personal journeys.
We are having an event that's basically going to be almost like a seminar on lung cancer, and that
is open to the public?
I believe it is, yes.
All right, excellent.